Hello guys and welcome back. If you're new to my channel, my name's Ezgi and I'm a 28-year-old doctor. I did medicine as a graduate student and I'm currently in FY2, which means I'm second year post medical school. So today I'm going to do a video of what's in my bag. And this is my bag. It's a Herschel bag. I don't know the model or anything, but this is actually the bag I used to use as a medical student and I just kept on using it at work. So basically, I don't like using my fancy bags to work. Reason being is when we go to work, we usually just chuck them underneath the doctor's desk and it's sort of a bit dusty there depending on when it's been cleaned, and people sort of kick it with their feet and so on. So I don't like to take my nicer bags. I'd rather just take this and I'm not so worried about it getting ruined. So you might be thinking, don't you have a doctor's mess or a locker or something where you can put your things? We do have a doctor's mess, but in my hospital, it's across the car park and it's just really inconvenient to get to. Nobody ever uses it and we just decide to keep our bags with us in the office that we work in and just keep an eye on it. Knock on wood, nothing's been stolen out of my bag till now by leaving in the doctor's office, but I know others have had that in other hospitals. But that's a topic for another day. If you want to see more of my content about life as a doctor, then hit subscribe and like this video, and let's get into what's in my bag. Okay. First things first, actually, in the front pocket, I think, is my ID badge. So this is my ID badge. Where does it say? FY2 doctor, so everyone can identify who you are. And on my badge, I have a card that gives me access to the wards and other parts of the building. And then I have what we call a smart card. And this is a card that you use to put in, you might see the little slots into the computers, and this allows you access to other things, one of them being looking at GP records to work out people's medications. That's that. And then also we were just given this card. It's got prescriptions for palliative patients, which is just quite useful to know the doses and stuff. So that's what I usually have hanging on my neck with a pen and my bleep. Next, my stethoscope. So I bought this in medical school. I think I brought it when we started our clinical years. So in my uni we had 2-3 years of lecture-based studying and then 3 years of clinical-based stuff, which where you were in hospital and you were getting taught at the bedside, etc. So I brought this stethoscope. It's one of the cheapest ones. It's by Littman. It does what it's supposed to do. So I bought mine in the colour raspberry. These are actually pretty expensive. I think the basic price for them is about £50, but then if you want to get them engraved, which I have just here, and you postage and packaging and blah blah blah, it comes to just under like £100. So when it first arrived, I was so cautious with it. I was like, oh my god, this can't get damaged, I need to look after it so well. And then now I'm just like, get in my bag, I need to go home, and I just chuck it around, which I shouldn't do really, but it's been all right for now. Since now, I mean, one of the earpieces have got a little crack in it, but still works. I can still hear your chest. Next, I have my water bottle. So I've not been using any plastic bottles for a while now. I came across a few videos on YouTube about plastic waste, and it really made me think about how much plastic we use without actually thinking. You just sort of use it and throw it, and it's just part of normal life now. So I decided to invest in some water bottles and a coffee cup, which I'll show you. So this is what I use. It's quite big, which is good. I'm quite lucky if I can get through this in one day. Actually, this is around 750 mils. So I just fill that up at home and at work if I need to, and have that on the go. That's followed by my reusable coffee cup. So I have the Keep cup. This is glass and it's got this cork bit. I mean, to be honest, I bought this glass and the cork one just because it looked nicer than the plasticky ones. But actually it's really nice because, you know, when you're having a cup of coffee, just having it in a glass cup actually makes such a difference. It just feels nicer. Saying that, I've got my coffee here with me actually. 1 second. In our hospital we have Costa coffee, I think that's true for every hospital. I don't know if they've got like some special partnership going on, but everyone has Costa coffee in a hospital. So every once in a while when I fancy a drink, I'll go downstairs and I'll get my coffee, and I think you get some money off as well if you use your own cup, which is a bonus. And then, so I decide to take my lunch to work, and I put it in this little lunch bag. So basically, the lunch that's served in most hospital canteens aren't the best. And actually, I think it's to do with the contracting or whatever they do. I don't think they actually cook the food on site. I feel like it's all like ready-made food that they just unpackage, heat up and then serve, which I really don't like. And it's really expensive. A meal is around £6-7, and as a staff, as a member of staff, you only get about 10% off. So that's not that much cheaper. And if you think about having that every day, that works out to be quite expensive. So for healthier lunches and to save some money, I take my own lunch to work. So I have this thermos one. It's quite handy because the inside is like, this is my lunch from the other day. The inside is sort of lined like this, and I've had so many like little spillages just because my lunch boxes haven't been the best, and this has kept my bag clean and smell free. If you didn't know, doctors are the best pen thieves. You will leave your pen on the side for 2 seconds, turn around to speak to someone, you look back, it's gone. Okay, we write with pens a lot, and pens get lost, pens get dropped, they run out of ink, and so people just sort of use each other's pens, which is fine, I'm joking. But because of that, you need to have more than one pen, otherwise you're kind of screwed. So I have all these pens. They have to be black, apparently, because our notes get photocopied, so for the best photocopy quality, we need to write in black. So I have all sorts of black pens in the bottom of my bag. And then I have my makeup bag. So this is a makeup bag I got personalised when I was on my honeymoon in Santorini. And it's basically just got a few lipsticks, but the most important thing I have in here is actually a hand cream. So in between patients, we either gel our hands with alcohol gel or we wash our hands. And what that means is that you're washing your hands up to 20 to 30 times a day. And that can mean that your hands get really dry. So I always have this hand cream with me that I use in between when I'm doing work in the office to sort of replenish the moisture that I've lost. So that's that. And then I have my glasses. I used to use these as a medical student a lot actually, but then ever since I started work, I didn't really wear them. And then when you do wear them out of nowhere, all of a sudden everyone's like, oh my god, you wear glasses? And then it's all just a bit weird. But yeah, so these are my glasses. They're my Ray-Bans. They're actually really nice. I need to start wearing them again because I'm going to start revising for my GP exams. And this is what they look like. Oh, I need to get my prescription changed. I haven't been to the optician for like a couple of years. All right, I need to get that sorted. This is a lifesaver. So you might be thinking, wow, why is it so big? But basically this is a power bank for my phone, and because I have such a big bag anyway, I really don't mind carrying a big power bank. My phone is an iPhone 6s and it's slowly dying, and the battery life is not great. So because I use my phone a lot during work, my battery life doesn't last the whole day. If I don't have 100% charge in the morning, then it doesn't last all day. So I always have this with me to make sure that I don't run out of charge. For those sweaty moments when it's 30 degrees outside and your hospital doesn't have aircon and your doctor's office doesn't have a window, you need this. So these are tapes that once you take blood from a patient or want to put a dressing on somewhere, you sort of tape it up with this. I keep these on my lanyard, so I pop them at the bottom, but when my lanyard's in my bag, they sort of just fall out, and I always rummage through them for them and I can't find them, so I just go grab another one from the stocks room. And so I've just realised now, after emptying my bag, that I've actually got 4. Yeah, I might throw this one away actually, it looks a bit gross. So you might be thinking, is the stethoscope the only thing you take to work? don't you use anything like tendon hammers and pen torches to look into people's eyes? That's true, but with us, the hospital provides that for us, so you don't have to go around with your own equipment. The only thing that you need are stethoscopes. There are stethoscopes on the ward as well, but they're the crappy, cheapy ones, and I really don't want to put things in my ear that everyone else has been putting in their ear. So yeah, so we get provided all of that in hospital, so we don't have to take our own stuff. And the most important thing that I need at work after my stethoscope and my ID badge is actually my phone. If you've watched my top 10 tips for F1 doctors, you'll know that there's a few apps that I use on my phone every day. Some of them are to look up drugs and drug doses and what the drugs are and their side effects. The other ones might be antibiotics and antibiotic guidelines, and then just other things to work out dosing, apps to look up extension numbers in your hospital. So I usually have my phone on me all the time, and I'm usually on it all the time. And there was this one day I went to work without my phone, and although it was quite refreshing to just be free and not be looking at a device all the time, I did need it, and I kept on asking other people for their phones and using their apps and stuff. So that's definitely something I can't do without. Don't think I've forgotten. Let's announce who won the giveaway. So I asked you guys to leave me a message on my previous video. Thank you for all those who have done it, and let's now choose who's won. Okay, so I've got all the names in this bowl, my salad bowl, and I'm just gonna pick someone out now. Chog Eye Studies. Well done. You get the giveaway, which, if you've forgotten, were these study cards from Oxford Handbooks Medicine line. Well done, I'll be sending this to you soon. Go onto my Instagram, send me your address, and I'll post this to you as soon as I finish my night shifts next week. See you in my next video, guys. Bye.